One of the common pediatric problems that physicians who work in a pediatric emergency department face is the diagnosis of acute appendicitis. Children can come in with a classic presentation of abdominal pain in the right lower quadrant, vomiting, nausea, decreased appetite, and fever. We know that in younger children, their presentation tend to be a bit more delayed, and sometimes they will present with a diagnosis of perforated appendicitis. I thought we could do a little segment on the use of point-of-care ultrasonography to make the diagnosis of perforated appendicitis in the emergency department. So whenever we see those patients, we try to take a look at the right lower quadrant in order to identify the appendix. But in the case of perforated appendicitis, only up to 40% of cases will actually have a visualized appendix on the ultrasound. So there's another few key POCUS features that we can use as a surrogate of acute appendicitis that perforated. The first one of them that's worth mentioning is the presence of an abscess or a loculated fluid collection in the right lower quadrant. If you see that fluid collection in a child that has a high clinical suspicion for appendicitis, the diagnosis of acute appendicitis that perforated is actually quite likely. Other features that you can look for include the presence of an appendicolith, the loss of the submucosal layer of the appendix, if you can visualize it. The dilated bowel loop also can be seen, and also echogenic fat. There was a recent paper published in 2015 by Tulip Silver that looked at different symptoms and predictors of perforated appendicitis in children. And they actually found that the constellation of dilated bowel loops, loculated fluid, along with right lower quadrant echogenic fat, had a specificity of 99% for making the diagnosis of perforated appendicitis in young children. So I think when we have the children with the classic constellation of acute appendicitis, we can still make the diagnosis of perforated appendicitis using POCUS in the emergency department, knowing what to look for. So just to summarize, the visualization of loculated fluid or abscess is very specific for this diagnosis, along with dilated bowel loop, presence of appendicolith in the right lower quadrant. So I hope you guys found this video useful, and if you did, please subscribe to the channel and we'll have more videos coming for you.